Mastitis affects approximately 2 to 10% of postpartum American women. Even though this equates to as many as 50,000 to 400,000 women annually, it is known to be an underreported medical condition. A common and often underdiagnosed complication is mastitis. The more severe form of mastitis is cellulitis, which is where the interlobular connective tissue has been infected. Symptoms may come on suddenly after about 10 days postpartum. One breast may have a pink, tender, hot swollen wedge-shaped area, a fever of 38.5 Celsius or greater, with chills and systemic flu-like aches may be one of the last symptoms. If untreated, abscesses or septicemia may occur. A breast abscess presents similarly to mastitis, except that there is a firm area in the breast, often with a fluctuance, which is an indication of the presence of pus in a bacterial infection. An abscess can be confirmed with an ultrasound. Abscesses are treated with surgical drainage or needle aspiration, which may need to be repeated. Fluid from the abscess is cultured and antibiotics administered. At the start of a feed, when the baby suckles quickly, the physiologic mechanism is to stimulate the letdown reflex in the mother. Oxytocin, released from the posterior pituitary, causes myoepithelial cells to contract, leading to milk ejection. Recent studies find that each breast contains 4 to 18 milk ducts, arranged in a complex network, converging at the nipple. In each breast, there are 4 to 18 lobules containing 10 to 100 alveoli. The alveolus is the site of milk synthesis. Secretion consists of clusters of epithelial secretory cells or lactocytes. Lactocytes are surrounded by myoepithelial cells to form smooth muscle contractile units, which are responsible for ejecting milk into the ducts from the lumen of the alveoli. Ducts are capable of increasing in diameter temporarily to accommodate the increase in milk volume at milk ejection. Staphylococcus epidermidis is similar in cluster shape to Staph aureus. It is also an inhabitant of the skin. This organism produces a slime resulting in biofilm formation. It is the ability to form a biofilm that makes this bacteria particularly virulent. E. coli are a large and diverse group of bacteria. Although most strains are harmless, others can cause severe infection. An antibiotic that can be tolerated by the infant as well as the mother is generally prescribed.
I had all these antibiotics going through me, and I was thoroughly convinced that I wouldn't be able to, and she said, no, please, please, please keep nursing your baby. And I thought, my gosh, you know, if she's the expert and she says that's what I should do, then... And he loved it, so it broke my heart to have to say no. And so we just kept doing it because he loved it, and she said that was the best thing. So.